Every second counts in saving lives. Behind every result is an important decision, life impacted, and a story worth telling. This is the story of Mr. Lasantha.
Lasantha, assarinna baranna. Friends, C-IDC එකක් බලමු මෙයාගේ. කල්ලුත් මෙහෙම සීන් නැති වෙලා තියෙනවද? කලින් වෙලා නැහැ. ඒකවා දකින්නකොට දාඩියෙන් දරාගෙන සීන් නැතිලා හිටියා. ඔව්. වයස කියන්නේ හතර. ලෝ CBS තියෙන නිසා අපි මේක කන්ෆර්ම් කරගන්න අපි වීනස් සැම්පල් එකක් ගන්න අනිත් ටෙස්ට් වලටත් එක්ක liver function, renal function, insulin, C-peptide.
Hypoglycemia was confirmed by measuring plasma glucose. Blood samples for insulin and C-peptide were also taken to differentiate between endogenous and exogenous causes. Once the blood samples are collected, intravenous dextrose was administered.
Basanta, assarinna balanna.
Improvement in the symptoms following dextrose administration fulfilled the Whipple's trial.
Hello, biochemistry lab.
Hello, I'm Dr. N.E.Galmangodage from Emergency Treatment Unit.
Let's follow the journey of a blood sample. When the nurse collects the blood, she carefully places into the labeled tubes. Since plasma glucose and insulin are unstable analytes, tubes are immediately placed in a slurry of ice. Next, courier staff pick up these samples. When the samples arrive at the laboratory, a laboratory assistant receives and hands the sample to a medical laboratory technician. The medical laboratory technician has two important jobs. First, they check that the sample information matches the request form. Then, they process and test the sample. They follow strict quality steps to make sure that the results are accurate. If any test results show unusual values, they are sent to the chemical pathology registrars. These doctors look at the results along with the patient's medical history to make sure everything makes sense. The chemical pathology laboratory plays a key role in ensuring the accuracy and precision of glucometers used in the clinical ward. This is achieved through a method comparison comparing glucometer readings with those from a central laboratory's automated glucose assay.
Results of Mr. Lasantha showed elevated insulin and C-peptide levels in the presence of hypoglycemia. This is suggestive of endogenous hyperinsulinism. Still, we went ahead with PEG precipitation and checked anti-insulin antibody levels to exclude insulin autoimmune syndrome.
The endocrinology team investigated the patient but could not find the insulin secreting lesion neither clinically nor by imaging.
Our next step would be to do the imaging to look for a cause. We did the pancreatic protocol CT imaging, which turned out to be negative. Then we proceeded to do an endoscopic ultrasound, which was also unfortunately negative. Best and the only option to make a firm diagnosis and to go plan for definitive management is a selective arterial calcium stimulation test with the help of our chemical pathology colleagues. The importance of the availability of such tests and the chemical pathology support was invaluable in managing this patient successfully.
Selective arterial calcium stimulation test is a procedure where calcium is injected into different pancreatic arteries. If an insulinoma is present, it will respond by releasing insulin.
By doing so, we were able to localize the insulin secreting lesion to the body of the pancreas.
These findings were discussed within a multidisciplinary team meeting involving clinicians and laboratory professionals, and it was decided that the best management was to proceed with distal pancreatectomy.
Mr. Lasantha has made a complete recovery and now he is leading a normal life. We can say from the beginning, laboratory played a vital role in his management.
පෞද්ගලික දවස්වල විතර සීනතු හිටියා. පරීක්ෂණ කරලා ඔපරේෂන් එකක් කළා. පස්සේ තාම එහෙම දෙයක් වුණේ නැහැ. දැන් හොඳයි. ඒ සම්බන්ධ සාරෝහලේ සහ ලැබ් එකේ කාර්ය මණ්ඩලයේ මාගේ ස්තුතිය මෙයින් ප්‍රදානය කරනවා. බොහොම ස්තුතියි.